Hello, my name is Dr. Bob DeMaria, and today we're going to get to know a little bit more about cholesterol. So we're going to be pursuing learning about cholesterol and what we need to do to help bring it down to normal levels. Let me tell you a little bit about cholesterol. First, it's not a fat, it's an alcohol. A lot of people have misconceptions about what cholesterol is and what it is not. Do you know your number? Do you know your cholesterol number? Well, a lot of people get really concerned if their number is above 200. If it's 225 or 235, well, my concern for you is the fact if your cholesterol is getting above 230 or 240, you're probably eating too much sugar. Cholesterol is not good. Cholesterol is not bad. Cholesterol is beneficial to your body. It's used in every cell in your body. Cholesterol is actually a steroid. So let's slow down a little bit so you can wrap your brain around how is cholesterol really impacting your body. Your body uses cholesterol to make all the other steroids. And you can say, what's a steroid, Dr. Bob? Well, I'm sure that you understand when people are bodybuilders, they take different types of drugs to help make their bodies artificially big. Well, the cholesterol is a steroid, which means it's a building block that can make sex hormones. It can make hormones to break sugar down inside of your body, and it also can make hormones that help your body to absorb minerals better. The big concern today in our society is when you have high cholesterol, they feel that it's impacting your heart and it actually can cause heart disease. I'm not going to totally disagree with that because we see cholesterol levels really high. I know you're probably eating too much sugar and too many refined foods that are causing inflammation inside of your body. So let's talk about cholesterol as it could be related to a fireman inside of your body. You know, firemen are very important. What do? That's right. Firemen put out fires. Well, at the beginning of the program, I mentioned to you that cholesterol is not a fat. It's actually an alcohol, and it cannot float in water by itself. In other words, it cannot go in blood by itself. It needs a transporter. So if cholesterol would be similar to a fireman, and firemen put out fires, how do firemen get to fires? They go on fire trucks. Now I want to explain to you a little nugget. There are two fire trucks inside of the body. There is the LDL fire truck that takes the firemen to the fire, and there's the HDL fire truck that takes the firemen back to the firehouse. We think of the LDL as the bad guy. LDL is not the bad guy. The LDL cholesterol is taking firemen to the fire. So let's just say that you're beneath a lot of stress. I'm going to flip your switch here a little bit. Cholesterol is used in your body not only to put out fires, but cholesterol is used in your body to make cortisone. Cortisone takes away inflammation. So the cholesterol in your body is actually the precursor or the building block to make the cortisone, which puts the fire out. So all of a sudden, you have this pain and inflammation inside of your body. Your body's using all the cortisone, all the firefighters. So it says to the brain, I need more cortisone. So what does the brain do? It makes cholesterol. First, you're going to have cholesterol, and it's going to make two other hormones. Two big words I'm going to give to you right now. One is called pregnenolone. Big word, isn't it? The other one is progesterone. Progesterone becomes cortisone inside of your body when it's needed. So if you go to your doctor, you've been having a lot of pain, you're not feeling good, you're depressed, you just feel lethargic, and he draws your blood and he says to you, whoa, your LDL is so high, we need to give you a medication to lower that. Guess what? That's like literally shooting the fireman on the way to the fire. Do you hear what I just said? When they give you certain medications which have bad effects, and one of the most common medication is a statin drug, And a statin drug works by interrupting cholesterol metabolism inside of your liver. Well, what happens then is you start to have bad effects. Now listen, this is significant. I'll have patients that come into my office that'll have pain in their body once they start taking statin medications. And do you want to know why? Because when you're taking a statin medication, it's taking the cholesterol out of your body that's used to make cortisone. Do you hear what I just said? Here's the question that nobody ever asked, and I'm going to ask you the same question. What's causing the fire? Think about that. What's causing the fire? See, if we could put the fire out, we wouldn't need all the firemen going to the fire. Well, I have found 2 or 3 areas that will increase the fire. Number 1 is sugar. The average American consumes about 150 pounds of sugar every year. That's a half a teaspoon of sugar every 30 minutes. That's not healthy because the sugar is going to stress that gland called the adrenal gland that makes more cortisol. The second one, and this is going to be really interesting to you, is trans fat or partially hydrogenated oils. Do you know, about 30 years ago, they're having everybody use margarine. Margarine was made of trans fat or partially hydrogenated oil. They felt vegetable oil did not have animal fat in it, and it would not alter your cholesterol. But in essence, the trans fat or partially hydrogenated oils causes inflammation inside of the body,